Angioplasty is a non-surgical or interventional procedure for patients who suffer from a narrowing or blockage of arteries caused by the buildup of plaque that restricts the flow of blood and nutrients to the heart, a condition known as coronary artery disease.
The reason a patient has a cardiac cath is because there is a suspicion of bad blockages in their arteries or a bad valve, and you need to do a diagnostic test to accurately determine what the problem is.
Angioplasty is actually life-saving for patients with very acute cardiac problems, such as acute heart attack. There's another condition called ACS, or acute coronary syndrome, where early angioplasty has also been found to be life-saving. In addition to that, there's a large group of patients with angina who are more stable, where angioplasty has been found very useful for relieving their angina.
During the catheterization, a guide wire is inserted through the groin, followed by a thin tube called a sheath. Another thin, hollow tube called a catheter is guided through the sheath to the artery surrounding the heart. Dye, or contrast material, is then injected into the catheter. As the dye moves through the arteries and chambers of the heart, its movement is digitally photographed so the physicians can identify the locations of the blockages. After the location of the blockage is identified, the catheter, with a small balloon at the tip, is then reinserted near the blockage or the narrowing in the arterial wall. When the catheter reaches the blockage, the balloon is inflated, pushing the artery open and widening the blood vessel enough to increase the flow of blood and nutrients to the heart. Oftentimes, balloon angioplasty will involve a metal stent, which serves as a brace and keeps the artery open after the balloon is deflated and removed. The stent stays in place and the arterial wall heals around the stent with blood flow restored. For more information on angioplasty or the New York State Department of Health rankings, please visit our website at northshorelij.com.